Hello, I'm Ron Jica, President of Melbourne Regional Medical Center, and I'd like to welcome you to the future of medical care on Florida's Space Coast with the opening of this 35,000 square foot addition to our surgical facilities. This expansion is far more than just extra space. We've added the most advanced technology, all centered around patient safety and excellent outcomes. We're excited to offer this level of surgical advancement to our patients and our community. Thank you for choosing Melbourne Regional Medical Center, Brevard County's premier choice for surgical care. Let's take a look inside.
This expansion includes 4 new surgical suites, with more set to come online in the future. These are between 25 to 50% larger than the existing operating rooms, and the technology is absolutely state-of-the-art. Our facilities are designed to ensure patients receive the most advanced surgical techniques. And that's not all. These surgical suites are designed to provide advanced instruction to visiting physicians and physicians in training. Other areas here, such as sterile processing, staging, and post-op, are equipped with the latest and best equipment available. It's all part of our commitment to your practice and to the well-being of people living on the Space Coast and beyond.
This is one of Melbourne Regional's new operating rooms. In this room, the air pressure and temperature and humidity are controlled carefully to provide maximum safety to our patients. The construction itself is designed to protect them from any possible infection. For example, there's no seams in the floors. It's all heat welded and smooth so bacteria cannot hide in any of the joints. A system of HEPA filters purifies the incoming air, screening out microscopic contaminants that could put the patient at risk during surgery. The walls in these rooms contain metal panels from the floor to the ceiling, so patients and medical staff remain safe. And here's something we're very excited about. These rooms are equipped with powerful ultraviolet lights that come on when the rooms are unoccupied. Even during the nighttime hours, the UV lights bathe the room in a purple glow, killing bacteria, viruses, a continual sterilization process. There are outlets everywhere, plenty for whatever purpose is necessary. Plugins are always close at hand, so the surgeons can connect to their equipment or just listen to their favorite music during surgeries. These rooms also contain the most up-to-date imaging equipment, microscopes, surgical robots, and many other high-tech devices. We have the latest in lasers to disintegrate kidney stones and knee scopes with cameras embedded in them. In addition, each OR is equipped with multiple camera feeds in which physicians can zoom in on certain areas of the surgical procedure. These cameras serve an important educational purpose here at Melbourne Regional. The monitors displayed in 2 of the ORs are fed back to classrooms where physicians in training can watch and learn. It's a two-way system, allowing active classroom participation. The observing physician has access to a control panel to zoom in on the surgeries, ask questions, and interact with the surgeons during the procedure. We offer another important educational option too. Physicians in training can learn new procedures in our simulation lab, performing techniques on cadavers and models. It's a way for us to constantly improve our knowledge base and consequently upgrade the care we provide our patients. If you're a physician, you'll enjoy the many conveniences and extras we have to offer here at Melbourne Regional.
Melbourne Regional has added a number of post-anesthesia care units, or PACUs. There are 12 new Phase 1 PACUs, which receive patients immediately after surgery. We have 7 private areas for patients who are awake and ready to be discharged. These areas are equipped with an advanced telemetry system to monitor the patient's vitals as they begin emerging from their anesthesia. Previously, only nurses in the PACU monitored the patients as they went from room to room, checking on patients. Now the data is routed to a remote location where other skilled professionals can assist in this monitoring process. It's an extra layer of care, ensuring that someone is always watching a postoperative patient. Another of the exciting changes is the addition of several amenities for our physicians and other medical staff. For starters, we've greatly expanded our locker rooms and have added showers so staff members can refresh. In addition, Our new staff lounge seats up to 40 people. Here's a feature we know you'll appreciate. The physician lounge now contains dictation rooms where doctors can go for extra quiet and privacy. These amenities, combined with all the educational features that Melbourne Regional now offers, make this an excellent choice for physicians to practice here on the Space Coast.
As I'm sure most people are aware, proper high-quality sterilization of medical instruments is absolutely crucial. There can be no shortcuts. This is why Melbourne Regional has purchased state-of-the-art equipment and adopted leading-edge processes to keep bacteria and other contaminants away from our surgical patients. Our sterilization procedures begin with bringing carts filled with used surgical instruments into the processing area through badge-controlled automatic doors. The instruments are then removed from the carts and placed into the sink for hand washing. The carts are then placed into an automatic washer. The instruments, once hand washed, are placed into an ultrasonic cleaner with special detergents. They are then washed a third time in specialized washers that use steam and purified, near pristine water created by reverse osmosis. Both the carts and instruments are passed through their respective washing machines into separated rooms to avoid cross-contamination. The staff then separates the instruments and places them into trays specified for individual operations. The trays are wrapped twice with specialized coverings and placed into the sterilizers. 3 low-temperature sterilizers are reserved for scopes and other delicate instruments used during these procedures. This process uses hydrogen peroxide and sterilizing gases. The other instruments are placed into 3 new high-pressure, high-temperature steam autoclaves. The processing environment is tightly controlled to prevent heat and humidity from entering into the clean areas. Finally, the instruments and other sterilized items are passed through sterilizers into a third room for storage until they are required by the operating room. This storage area is significantly larger than our older one. Overall, this new leading-edge processing area helps us work more efficiently and effectively. Patient safety is our #1 priority. This is one step in assuring the best medical care for our patients.
We hope this look at our new facility and technological offerings has been helpful. As you can see, we're fully equipped to serve the surgical needs of Brevard County and the Space Coast. We invite all of our community surgeons to practice here at Melbourne Regional Medical Center. Thank you.